Hello everyone, I'm Dr. Mohal Banker from Bankers Vascular Hospital and I'm intervention radiologist. So today we are going to talk about the interesting case of vascular malformation. This vascular malformation, patient has in the shoulder joint and this vascular malformation is a slow flow vascular malformation. So vascular malformation is very tricky disease because it's a very rare in our society, and that's why even our doctor fraternity also doesn't know how to proceed for the treatment. So there are two kind of vascular malformation. One is called the high flow vascular malformation and second one is called the slow flow vascular malformation. And particularly when we are talking about the vascular malformation, it's a basically this vascular malformation is made up from these abnormal blood vessels, and these abnormal blood vessels is called the nidus. And the inner lining of the nidus, inner lining of these blood vessels, abnormal blood vessels, are made up from the undifferentiated cell, which has a very high growth potential. So that's why the basic target for treatment of vascular malformation is to destroy these nidal cell so it will not grow in the future. Now there are different options for treatment of the vascular malformation which is offered by many in our doctor community. So first one is surgery. So surgery is ideal for the localized vascular malformation, because what happened if we remove the partial lesion of the vascular malformation, then the remaining lesion will regrow and it will recur into the future. Similarly, the glue, the coils or the gels and other sclerotherapy, these will block the lumen, but the inner lining of this vascular malformation is these cells are live and it will regrow into future. So ultimately patient feel little bit symptomatic relief for the short term, but again in the long term it will regrow. So target is to destroy the nidal cell, and for that what we are doing, that's injecting absolute ethanol embolization. So absolute ethanol embolization is a basic and permanent treatment for vascular malformation, but it's very tricky and it's very dangerous if you use ethanol without some experience. Why? Because overdose of ethanol may leads to some events, cardiac events, and ultimately there are cases reported when the patients are died. So 1 ml per kg is the ideal dose for injecting ethanol, and we have to take care that ethanol should not enter into the normal blood vessels. It remains defined into the channel of the vascular malformation. So there are lots of tricks to do this, and that's why it needs an experienced hand of intervention radiologists who are treating the vascular malformation for the long time, and then there is a good results can be achieved. So right now what we are discussing the case of the shoulder joint malformation. The patient has a slow flow vascular malformation into the shoulder joint, and you can see that during the angiography, first we define the volume of the nidus, then we inject the ethanol. The whitish area inside this nidus, there is a ethanol injection, and once it start entering into the normal blood vessel, we stop injecting it, and that's how we control the ethanol embolization. It does not enter into the normal blood vessels, and the ethanol impact should be localized into the vascular malformation. Then we can achieve our targeted results. So slow flow vascular malformation, in this case I have shown you how we inject the ethanol, why the ethanol is a base treatment for the vascular malformation, and the problem into this ethanol embolization is that we cannot treat the entire lesion in the one sitting because it requires high dose of ethanol. If we inject the high dose of ethanol, there are lots of complications. So whenever we are treating the vascular malformation with the ethanol, we have to treat this lesion into the multiple session. So first, why? Because the first one, ethanol toxicity. Second one, there is a lots of pain and swelling after ethanol embolization. So we have to wait for to reduce this pain and swelling after the first embolization session, and then we can plan for the second embolization session. So hope you understand this topic very well. If you have any kind of question, query, do ask me. I would be very happy to give you answer. Thank you.